Dyspraxia is a developmental coordination disorder that affects both fine and gross motor coordination skills. This disease affects both children and adults because it follows them throughout their developmental phases. We will primarily be focusing on the fundamental phase, which occurs in the ages of 2 through 7 of motor development in children. There are three primary forms of dyspraxia: motor, verbal, and oral.
In a fundamental phase, we expect children to have a greater motor control and rhythmic coordination, and eventually learn to have mechanically efficient, coordinated, and controlled movements. Motor dyspraxia interferes with organizing and carrying out movements in a planned way, so children with dyspraxia lack basic coordination skills like catching, throwing, jumping, skipping, and will also have awkward posture when they run, walk, or even stand. Because of this delay in motor development, they may bump into people or things, drop objects while holding them, have trouble holding pencils to write or draw, and even struggle to play and interact with other children. Because of verbal dyspraxia, they also have trouble speaking at correct speed, volume, and pitch as well.
So there are 4 common ways to treat children with dyspraxia to improve their motor skill. Occupational therapy can help children develop everyday skills that are necessary for success in both home and a school setting by teaching them skills like how to use a fork, how to use a knife, or how to write legibly. So the speech therapist can determine exactly where the child's difficulty lies so that they can determine the exact exercises that could help them improve their communication skill better. So there are also perceptual motor training that target the aspects of a child's language, hearing, listening, and motor skills, which provide tasks that are challenging but not so challenging that the child becomes frustrated.
Lastly, physiotherapy can play a large role in the management of dyspraxia. Physiotherapists focus to improve the quality of the child's movement through exercises and games with the intent to improve self-confidence and self-esteem in their movement abilities. Many children with dyspraxia are misunderstood, whether it's because of their difficulty communicating with others or their educators being unaware of the symptoms of this disorder. It is essential that we inform educators so that children with dyspraxia can receive the necessary accommodations and interventions to allow them to succeed.